All right, so this afternoon we're going to kick off with a very relevant topic that I think everyone has been impacted by in some way, shape, or form. I know that some of our members have also had to deal with the impact of COVID within their own organizations. And while the entire theme of our conference this year has centered around looking beyond the pandemic, I think that it would be foolhardy for us not to take a moment and show some true respect to the pandemic that has reshaped the world that we live in. So I know that I am not alone when I say that over the past 18 months or so, most of us have honestly felt as if we were living in the twilight zone. From staying at home orders and physical distancing to wearing the wearing of face masks, we are certainly living in very unprecedented times. Joining me today to shed some much needed light on the current pandemic situation in the region, as well as what may be expected in the future, are Ms. Elizabeth Riley, Executive Director, Caribbean Disaster Emergency Management Agency, CDEMA, who has over 20 years experience in the area of disaster management at the regional and international levels in various capacities, and Dr. Joy St. John, Executive Director, the Caribbean Public Health Agency, CARPHA, who is an acclaimed public health specialist and former Assistant Director General at the WHO headquarters in Switzerland. Ladies, welcome to you both.
Thank you.
Welcome, Liz, and I believe that this afternoon, welcome, Dr. St. John. I believe that you will be kicking us off this afternoon with our discussion, so I will hand over the mic to you, and we'll come back in once you're done.
Okay, so I am going to start sharing my screen. Let me... Oh, I need some technical assistance because I'm not, finally. Now let me see if I can put that in screen show. I'm not sure how to get that in screen show with your system. So can you?
Okay, so I think.
Yeah, I can't access my presentation for some reason.
No worries at all. These things happen. That's the Asia we live in, right? So to the bottom right on the PowerPoint, bottom right of your screen, the PowerPoint.
Yes.
You would see an icon, a little box. I think it's perhaps grayed out now. I'm trying to look at it. If you click on that, it should open it up.
That stop share. So let's start.
Let's pull it up again.
Yeah. Yes, it's here, but I don't know how to find it on your system.
Okay, so what we're going to look at, bottom right on the PowerPoint, it's the first icon to the left. It's the icon to the left of the scroll bar. So the scroll bar at the bottom, you see like a line with an arrow in the middle?
I just can't see the screen to manipulate that. So I'm going to forget.
So we can talk through. Okay, we can talk through and then we can share the slides with the audience after.
I'm not sure why I can't find it on this screen, on my screen. So just let me, I can't even see it to click it through. It keeps going over.
So maybe what we can do is get Terry to present these slides and you'll simply tell him when to click through. How does that sound?
That sounds
good. Okay, so that's what we'll do. Just give us 1 second. We'll cue that for you and we'll get you started. We're just bringing Terry up. There we go.
So thank you very much for this opportunity to present. Next slide, please. And I was wondering why I was asked to be part of this, but when I had a conversation about the need for the banking sector to understand if we're finished with COVID, if we ever will, and how do we prepare, I was quite pleased to get this presentation together. So I am going to give you epidemiological information that I normally do not share with other sectors. And it is because it is important that you have an idea of what is happening in the Caribbean, but I would wish you to respect the privacy of our member states and not share these particular epidemiological slides. So next, we will start to see our epidemiological slides. Next, please. So the big picture, and this can be shared. And if you look on the left, you will see that there are over 244 million confirmed cases around the world. And in the wider Caribbean, including the Spanish-speaking Caribbean, there are over 2 million cases. And then for the CARPHA member states, mainly English-speaking and Dutch-speaking, we have only a drop in the bucket, not even 500,000 cases yet. And you would think, well, this is exemplary. But when you start to go behind the figures, next, please, you see why CARPHA has a concern. And the first slide up is the percentage increase in cases from October 18th. And look at that middle figure. It starts off with the wider Caribbean as 1.5. And then the next highlighted bar is CARPHA member states. And you will see going down that column that only the UK at the moment has a greater percentage increase in cases. And this has been the case now for quite a few weeks. In fact, for some time, the CARPHA member states were having a greater percentage increase in cases than all of the rest of the areas that I have shown you: USA, UK, Latin America, and Canada. And we became very worried in CARPHA. Next slide, please. And this gives you a little bit more of that behind the scene look at the numbers. The positivity rate is the percentage of positive samples in the overall number of samples taken. And I'm talking about PCR here, the gold standard for detecting acute COVID-19 disease. Have a look. We've got Suriname, and here we need to start being aware that this is not information that I generally share. Suriname has a positivity rate in their samples of 33.3%, which is pretty alarming. And you look down the line, Cayman Islands, incidentally, the UK overseas territories, because they receive vaccines early, have really good percentages for the most of them, coverage of the population for vaccination. These other countries that have high rates of positivity have very much lower percentage coverage of vaccination. And you will see going down the line that the positivity is in double figures down to Guyana. And then you've got smaller positivity to 0.2, 0.4, 1.8 in the UK overseas territories. We really need to be having a positivity rate as close to 1 or below 1 as possible, which is suggesting that the likelihood, the risk of transmission is quite lowered. Next slide, please. So we've got the 7-day moving average for all CARPHA member states. And this gives you an idea of the level of confirmed cases over the past week. And you can see we've really got quite some peaks, but nothing compared to what happened in August and September. We've come out of that a little bit, but there's still individual countries that are having quite a time with disease transmission. Next slide, please. There are over 81% of our CARPHA member states that have community transmission at the moment. Some of them are having waning numbers, and some of them have even started to get notification of de-escalation of their CDC travel alert status. Most of the CARICOM countries have gone up to the highest travel alert of 4. And what has been helping with improving on the risk of transmission, decreasing the positivity rates, and it has been the vaccine coverage. And remember, I told you that the UK overseas territories have much better coverage rates. So we're looking at Cayman Islands, stellar performance at 85.1%. And then when we go down the line around the middle, we've got St. Eustatius, Turks and Caicos. The Dutch territories would have had support from the overseas motherland. Then we have Barbados with 41.4% vaccine coverage. And we go all the way down to Haiti. Haiti hasn't really got their vaccine program off and running like other countries. And we've got Jamaica, which has been doing amazing numbers, but because they have such a large population, they really haven't got anywhere near the vaccine coverage that people initially used to speak of as being a safe vaccine coverage, which is 70%. But with Delta, Delta is more 90 and over if you're going to stop transmission in your population. So now we go to your sector. And CARPHA always looks at a sector and its ways of working to work out what are the ways that we advise, what are the protocols that we would suggest we put in place in the COVID season. Because I'm telling you no, until we have a global vaccination coverage, which is very high, we're not going to be rid of COVID because the CARICOM region is one of the most tourism dependent. So the banking sector needs to look at risk reduction because in this time we have an increase in cybercrime. You've got to look at cash currency management and operational issues, which will reduce the risk of your staff being exposed. Then there are the operational issues. If you do have cases in your organizations, What happens? Do you have surge to take the place of people who are either in quarantine because of contact tracing or in isolation because they've been exposed and are positive? Next slide, please. And that demands forecasting. Now, I know the banks are good at forecasting, but are they good at forecasting in a scenario where there's COVID and because of climate change and other issues, including the fact that there's a lot more zoonotic transmission, diseases jumping from animals to humans? It is predicted that there will be more of these types of rare diseases becoming rampant in the human population, and therefore the risk of epidemics and even pandemics has increased. No longer are we expecting a 100-year cycle for the next big pandemic. So you need to forecast. You need to understand and prepare for the scenarios that I've just quickly mentioned. And you also need to adjust your operational policies. You need to get away from the idea of everything going back to how it was. It's not going to be like that. There's going to be a need for you to have mechanisms and protocols and guidelines which prepare your staff and protect your staff for whatever is the next big communicable disease coming around the corner. Next slide, please. And that involves regulation. And I need to say that because we've got a contraction of the fiscal space, there is going to be the natural tendency to try to find other ways in which to ensure there is money in the system. And that means that there's going to be the need for the central banks now to have a flexing of their regulatory muscles and being more evident as watchdogs for the rights of the citizens in this post-COVID confusion, because we're not post-COVID yet. My feeling is that COVID will go into one of those vaccine preventable diseases needing a regular booster. If we're lucky, every year or every 2 years. Next slide, please. But I won't leave talking to you without emphasizing again the public health recommendations. It's not because we want to sell masks. In fact, the need and the desire for procuring masks has put masks in one of those categories of weak supply chain and supply chain issues. But this is one of the most cost-effective mechanisms for reducing disease transmission and contracting disease. We have had a great fall in communicable diseases like the flu in these past 2 years because people are wearing masks. You cannot dig your way out of this hole that COVID has placed us in without vaccination, let me say. It is a personal choice for each person, but vaccination is required as well as wearing the mask, sanitizing, and keeping your distance, not 3 feet, 6 feet. Next slide, please. And so we come to this issue of safe zones. Now, there is a vaccine mandate. This is not a public health institutional imperative. This is a political imperative. So I will not speak on mandates. But I will speak on safe zones. And safe zones have been interpreted in the CARICOM region in many ways. Some are linked to location. Some are linked to a category of worker. But let's think about the banking sector as a continuum. You need to make some decisions about if you want a bank to be a safe zone. Now, a safe zone in any parlance suggests that only certain people with certain requirements or additions, in this case, vaccinated people, can enter the safe zone or do business with the safe zone. Can a bank or a banking institution fall into that realm? Or should the banking institution start to define what is a safe zone. You may decide that you want to define your safe zone along the lines of your staff. Some of you have had unpleasant experiences across the region with outbreaks. So you may want to define what is a safe zone with your customers and your clients, especially if there's a lot of interaction. So I think this is my last slide. And I think I've given you some food for thought. And I know I've given you some bad news. COVID is not going anywhere anytime soon. So we need to think about ways of living and operating safely with COVID. Thank you.
Well, I have to say that I don't think it's necessarily a question of bad news as much as it is the reality of the situation that we are living in right now. So I do appreciate you sharing the very confidential information. And of course, we are bankers, so we operate under the principle of being able to keep information confidential. I would like to invite Liz to join us, Elizabeth Riley to join us now, and we can take the discussion forward. We will come back with questions for both of you. Thank you, Liz, over to you.
Thank you very much, Ms. Delmar. And I want to say good afternoon to everyone and a special thank you to the CAB for inviting CDEMA to participate in today's conversation. And I'm very happy to participate and follow on from the presentation by Dr. St. John and to share a bit of a perspective from the CDEMA side. So in the presentation today, what I'm going to touch on, just three things. To say a little bit about CDEMA for those of you who may not be familiar with us, because that sets the context really with respect to the trends that we have been seeing in the region in areas that lie under the CDEMA mandate, and then to talk a little bit about, from our perspective, what lies ahead and how that may have implications for you as a banking community. So some of you are probably aware we are, like CARPHA, an institution of the Caribbean community. We have a broad geographical remit, as you will see on the right-hand side. All of those territories in yellow are members of the CDEMA system. And in fact, in September this year, Dutch St. Martin became a member of our system as well. And what is important about this slide is that it signals diversity. Diversity with respect to the types of hazards that we face, and also diversity with respect to the kinds of capacity which lie within each of our CDEMA participating states. On the left-hand side, I won't go into this in too much detail. You're probably aware of some of the things that we do, including coordinating relief, etc. But that's not really the heavy focus of today, and you can have this for reference later. So we work on principles of resilience, and this is our regional strategy. And these are the sort of the entry points that CDEMA works with all sectors, including the financial sector. You'll notice one of our high-level result areas is related to sector-level integration and looking at resilience conversations within various sectors, including that financial sector.
Liz, sorry, before you continue, because I realize there's some very pertinent information, if we could get you to move to your presenter mode, then we would also be able to see your full slides. And if you need our support, if Terry has your presentation, we would be happy to do the same thing. And that is to present for you so you can read your notes and we will push through on your behalf. Is that okay?
Sure, Wendy. I apologize. I thought I was switched to presentation mode and I'm seeing presentation on my screen. So would you like me to share? And
yes, and Terry will come in. So we'll just give us 2 seconds so that we can take over the screen.
Absolutely. And if Terry can put slide 7 on the trends, that would be fine.
All right, perfect. We're there.
Okay, wonderful. So just to say a little bit in terms of the trends that we have been seeing, because even though we're talking today about COVID is a hazard. It's a biological hazard. It's a hazard where the leadership for addressing it lies within the health sector. But the reality is that within our Caribbean space, we are existing in a very complex multi-hazard environment. And the complexity comes at a number of levels. So it is about the diversity of the hazards that we face, as you can see on screen, but it is also about how those hazards are changing over time. Dr. St. John mentioned the phenomena of climate change. I know you as members of the banking community, but more importantly, members of the general community, understand that with a changing climate, we expect to see changing dynamics with respect to the hydrometeorological hazards. We're already experiencing that. But what we're also seeing is that no longer are we having conversations only about single hazard impacts, but we are seeing that hazards are happening in combinations. And these combinations can be where hazards happen in parallel. And a good example would be in St. Vincent and the Grenadines earlier this year, where we were operating on a backdrop of COVID-19, which cases had been seen in St. Vincent and the Grenadines since last year, March, and were continuing as for all of our CARICOM states. We were in the midst of a dengue outbreak, which is not unusual in many of our territories. That was ongoing at the time. Then on top of that, we had the Soufriere volcano transitioning from an effusive eruption to an explosive eruption. And with that, because of the change in the physical landscape, we saw a new hazard of lahars, which were occurring and still continue to occur every time we have severe weather events. Severe weather events compounded that. And in addition, we were seeing landslides and floods occurring in St. Vincent and the Grenadines, not just affecting the red and the orange zones, which were being highlighted and given the focus because of La Soufriere, but also in the green zone, which was the safe zone. So there are a lot of dynamics around the hazards in the region. And this, I wanted to sort of set this context because yes, absolutely, COVID is at the forefront of our minds now, but we are dealing with a more complex environment. And as a banking sector, it is important to recognize the various sources of concern and the various hazards that can impact on your own operations. Next slide. Also, by way of trends, is what's been happening in terms of disasters, damage, and losses. So on the left-hand side, there are two lines in the graph, a blue and a black one, generally trending upwards. And what is that saying? It is saying that over time, what we're seeing globally and also in the Caribbean region is a trend of the increasing number of disasters that are actually occurring. We are also seeing, as the blue line, I believe, is showing you, that the number of persons who are being affected in our communities is also increasing. But similarly, we are also seeing significant increases with respect to the damage and losses. And on the right-hand side, this is a graph showing some of the statistics on the actual damage and losses during the I would say landmark year of 2017, when we had the impacts of Hurricane Irma and Maria. So if you go to the next slide, we then get to understand a little bit now about how that is impacting us from a socioeconomic perspective and the implications for industries like the banking industry. So I made a statement a few months ago, and I've pulled it up here. It's on the left-hand side in the blue, that COVID-19 has radically altered the socioeconomic profile of our region. And I know you as a banking sector, you're well aware of this because it is the people that you serve that have been impacted. It's had an implication for persons' ability to be able to meet financial obligations which they've signed on to with your membership, etc. So what we've seen is that COVID-19, it has pushed thousands across the threshold of the marginal into the space of the vulnerable. And I think this is something that we are seeing not only with COVID-19, but we're also seeing it with respect to the implications of other types of hazards in the region as well. And it's also demanding that are already increasing the demands on our already stretched social protection system. So we have a very different type of socioeconomic dynamic happening because of COVID-19. And the reason why it's so acute is because of the protracted duration. Now, you listen to Dr. St. John. The health practitioners have guided us, and they're very clear. We cannot say definitively when we're going to see the end of COVID-19. So it means we're going to be continuing on this roller coaster, possibly for a while, and it will continue to have implications with respect to the kind of liquidity that we're seeing within the members of the population. It's not just affecting persons who are traditionally in the poor or vulnerable categories, but we're also seeing the middle income groups being impacted as well. And I think you are well versed on this as well. We also know that the disasters are affecting persons differently. So you have matters related to gender, which are coming to the fore, persons who are differently abled, phenomena which are being evidenced as a result of undocumented migrant populations. So you have all of these micro groups within the society who are being impacted in different ways as well. And on the right-hand side, just a quotation there from IDB on some actual statistics. Next slide. So let's talk about what lies ahead. And I want to just highlight three things that I think the banking sector needs to internalize. I think one, it's about the fact that resilience needs to be built in to the way you do business. And Dr. St. John alluded to this with respect to the COVID pandemic. And I want to really emphasize the point from the context of the multiple hazards that we face. And there has been a lot of conversation on what resilience means within the context of our CARICOM states. And back in 2018, we worked with a number of our regional institutions and partners and countries to come up with sort of 5 critical things that need to be looked at when we're discussing resilience. They're there on screen. So the social protection is one we talked about. Enhancing economic opportunities. And I think as a banking sector that there needs to be a conversation about the substantive role that you can play in terms of facilitating and enhancing economic opportunities. I think particularly in the context of recovery, and recovery conversations are already ongoing around COVID-19. But when you marry that with the complex conversations of recovery related to other types of hazard impacts, I think this is an area where the banking sector can see where it can play a role, and also speak to things like how can you support Pillar 3 on safeguarding infrastructure. With the other types of hazards, you see a lot of losses in terms of the built infrastructure. One of the things that we want to pick up with the banking sector, I've mentioned already to Ms. Delmar, is really about, how can we leverage the banking sector to build resilience in the built environment in our region? What kind of incentives could be put in place, for example, for those who build safely, or how can the banking sector promote building safety? So the other areas, environmental protection, operational readiness, and recovery. I'll speak on the readiness point in the next slide, if we can go there quickly, because we want to talk a little bit now about the whole aspect of business continuity planning, which of course the banking sector is no stranger to, because you are a business that really focuses on the issue of risk and how to address risk. But now in the context of what I've just discussed, you may want to look at the business continuity through a slightly different lens. So when we're talking about at the top of the diagram, the identification of risk and risk assessment, what we're looking at now is that as individual banks and individual branches, you need to really look at the full gamut of the hazards that are being experienced. And really, it's about learning from what we have seen, including in the pandemic so far, and how you apply that to your risk assessment process. With respect to the whole area of analysis on the right-hand side, what we're talking about in terms of the analysis of the impacts is that it covers not just business processes, but you also need to look at your physical infrastructure And also, I think the people dynamic, because as we have seen and Dr. St. John mentioned, there are direct potential impacts on your core resource, which is your people, as a result of events such as COVID-19. And you also see impacts from other hazards as well. And the final slide, flexibility and agility. And I really want to emphasize this. If we have learned nothing else during the COVID pandemic, is the importance of being flexible and being agile, and really being able to read the situation as far as practicable, guided by the health practitioners, and being flexible enough to make those adjustments to deal with the situation as we see it. And on the left-hand side, you see there's a factor there related to change, where you're moving from predictable situations into the unpredictable. And I think COVID-19, as Ms. Delmar, when she started in her opening statements, it really has been about an unprecedented situation. We weren't familiar with it before. And it's going to be a similar situation as we go deeper into the realities of climate change. So agility is going to be an important feature, and the need to be innovative as a banking sector on how we treat with these conditions. So thank you very much for the opportunity to make the contribution. I'm happy, of course, to take questions in the Q&A section. Over.
Okay, fantastic. Thank you so much for your presentations. Ladies, can we perhaps bring Dr. St. John back on screen? Liz, I want to just start off with your ending note there. Yesterday, we spent quite a bit of time speaking about agility and part of the agile strategic objectives of organizations, taking into consideration succession planning. And as we have seen, the impact of COVID suggests that not perhaps, but we really have no choice in who's going to be impacted and the extent of the impact. And so from an agility perspective and strategically thinking, I think that pandemic planning has to be part of that entire conversation. I know that we have a couple of questions that have come in from the audience during your presentation, so let me start with that. The first one first. All right, so who in 2020 indicated that the WHO, in 2020 indicated that a positivity rate above 5% was an indication the epidemic was out of control. Does this still obtain? I think Dr. St. John will give the first crack.
Yes, I will. This was a rule of thumb, but it's not necessarily one size fit all, because as we were late getting our first cases, we were able in the Caribbean to see what it was needed to ensure that we were able to deal with the cases that came our way. And so the Caribbean put on surge of personnel, surge of beds, surge of ventilators. And we also were able to procure among the different islands some of the actual treatments that you would have heard about in, say, North America. And CARPHA's Caribbean regulatory system would have recommended approval of some of these, like monoclonal antibodies. So although there is a lot of transmission, you have not seen a large increase in deaths for the most part. So yes, although there is transmission, for me, the sine qua non is how are we able to control that illness, especially in the more severe and critical cases. That being said, we do not like to have widespread transmission. There's the acute issue of COVID, but there's also something called long COVID, which will mean that the health services will need to tool up to deal with people who are having difficulties in functioning because they have brain fog, or they're having cardiac issues, or they're having liver kidney issues, or they're suffering the embarrassment of their hair having dropped out, which is one of the long COVID sequelae. So yes, we prefer to have it low. Remember, I said close to 1 or under 1, because that means that transmission is not likely. But even if it's over 5, the countries have wrapped up and tried to have the surge capacity to deal with illness and prevent death.
Okay, Liz, do you have anything different, or are you aligned with Dr. St. John?
I am always aligned with Dr. St. John. I would say, though, maybe just one other piece to add, Joy, is really related to, what does the positivity rate number really mean? Because it very much also depends, and I've learned this from my health colleagues, on how testing is actually being done in a particular country. So where you have a situation, for example, where there's random testing in the population, Dr. St. John can confirm for me, and you may see a positivity rate at a certain level. You have a sort of greater level of confidence in terms of what that is saying about the full population, as opposed to, say, if you're only testing being guided by contact tracing. So that's the only little piece I would add there. And I don't know if Dr. St. John wanted to come back or if you need to move on to another question. Over.
Just to smooth that out a bit, sometimes you can have testing in a population that is more likely to have positive cases. And therefore you have a skew, which doesn't really represent what's happening in the community. But overall, right now, I think the positivity rates that we're finding are quite reflective of what's happening in the community, because the testing strategies have tended to shift now that there is community transmission into what is happening in the community. And because in some countries there's widespread community transmission, because you have got an area, it does, even though it may seem high, it does actually reflect what's happening in other parts of the country. Over.
Okay, I think that sheds some light for everyone who would have been on with us this afternoon, and certainly I hope that answers your question from the audience. Can you please cue for us the next question? Okay, generally individuals within the region have been very receptive to vaccines. What, in your opinion, has caused the surge in vaccine hesitancy, and how do we combat this?
So
okay, let's go.
I can take that, because CARPHA actually did a vaccine hesitancy survey in the region. And so we have actual statistics, and we looked at the things that worried people. And one of the things that worried people is that people thought this vaccine was developed too quickly. They were concerned about mRNA and newer vaccine technology. They didn't know what it meant, because it was not what they're accustomed to with other vaccinations, for example, tetanus, MMR, polio, etc., etc. So the other thing that is of concern is that there was active for more than a year, about a year and a half now. I was shocked at the depth of the onslaught of the Caribbean region with anti-vaxxers and this misinformation and some really scary things, which to my shock and awe, Caribbean people took up in great glee. This thing about the vaccine will start to track you. The vaccine will make you sick in 3 years, etc., etc. So the other thing too is that unfortunately, a lot of specific groups that had agendas also took up the anti-vaccine discussion, even if they weren't anti-vaxxers. And these groups have focused on their clients, their parishioners, because there is a whole swath of religious groups, mainly the evangelical churches, that have actually been saying things like the vaccine is a mark of the beast. If you're a good Christian, don't be vaccinated. The surge in vaccine hesitancy we not only documented what people were thinking about and concerned about, but we documented who they trusted. They trust the doctors and nurses in their communities, the doctors and nurses in agencies like CARPHA and PAHO. And we also found out where they liked to get their information. And a lot of them like to get their information in infographics. And so what we have been doing, and CARPHA has a network of health communicators in all of our member states. What we've been doing is working with our health communicators, and also we've been translating into our languages in the region and pushing the truth as much as we can. We've even worked with Facebook to try to get the message out there. It is not an easy one, but I'll tell you, there's some things that are being revealed. Caribbean people like to travel. And because we've been lucky to get Pfizer in recent months, we've seen an uptick, almost vertical uptick in vaccination rates. Also, Caribbean people wanted to get their children back into school, and Pfizer allowed 12 to 17 to be vaccinated. And that helped quite a bit with our vaccination rates and overcoming the vaccine hesitancy. But we keep working constantly on this. It's a big problem.
Okay, Liz, before I come to you, just want to prompt the audience. If there are any other questions, please post them now, as we will wrap up the segment if we do not have anything else coming in. So Liz, over to you with any additions that you may want to add to the response already provided.
Wendy, just to speak from a disaster management perspective and just to touch quickly on some of the implications of this. And we've had to deal with this already, for example, in St. Vincent and the Grenadines in the aftermath of the Soufriere eruption, and where you have a situation where a high number of persons who have not been vaccinated are required, for example, to be evacuated. And how does one undertake that type of a emergency support function safely without bringing additional harm to the persons who are either coordinating or those who are in fact being impacted by the event? And also from a shelter perspective. And this was of a particular concern. And in fact, we worked very closely with CARPHA on this particular issue, working to make sure that the guidelines that existed in the region previously on shelter management were upgraded. We ran training for shelter managers within the CDEMA system. So the conversation around vaccines and vaccine hesitancy, as we know, it doesn't stop there. It has implications for all other types of emergency support functions that have to be conducted. And the other piece that I would say is that one of the things that we're discussing now within the CDEMA system, because as you know, we coordinate what we call the regional response mechanism, where we bring surge support to states that have been impacted, is we are also now looking at our own policy position with respect to vaccines. We have an overall principle of do no harm. And as such, when vaccines were not there, of course, it was about operating safely. That was a very important part, and it continues to be an important part. But with vaccines in place, and Dr. St. John has been very clear that, vaccines really are going to be the way out of this situation with COVID-19. And from an emergency management perspective, it is important also that those who are delivering that humanitarian support are also protected by vaccines. So this is something we're looking at now from a policy perspective in terms of what we're going to be requiring for persons who support the regional system and assist other states in the aftermath of events. So I wanted to share that as well. Thank you.
Okay, I think this has been a very timely discussion, certainly assisting in decision-making from the industry perspective. And of course, we want to say a special thank you, ladies, for joining us this afternoon and sharing openly on what we see as possible futuristic problems associated with the impact of the COVID pandemic. I certainly I'm walking away this afternoon knowing that this is not the only pandemic that we are likely to face in the next few years. And so our response today is going to be critical to how we handle other pandemics or other instances of this nature in the not too distant future. So ladies, again, thank you so much for joining us this afternoon. I will ask that our audience, if you have not had an opportunity, please go through, meet with our ladies, CDEMA and the CARPHA, take a look at their website, see if there's anything else that we have that are important to us in decision making.